So what I was planning on talking about with my slides was actually just really picking up on what Francesca was talking about, and really wanted to give it a bit of context as why it's so important. I mean, Francesca talked about the impact on baby's health, on mother's health, but as a psychologist, I've always really been interested in what breastfeeding means for women. So I'm not talking about women who don't want to breastfeed or women who decide that it's better for them and their family to formula feed, but I'm really thinking about those women who really, really want to breastfeed and what it means to them when they're unable to do it. So we have so many policies in place to try and support breastfeeding mothers. But in the UK, we've actually got pretty much the lowest breastfeeding rates in the entire world. We start off all right. We have lots of women really, really, really wanting to breastfeed, but actually the experiences they have in the weeks after starting mean that our rates fall really, really rapidly. So we only have about half of women breastfeeding at all by about 6 weeks, which is fairly low. The main bit about that statistic for me is 90%, 80, 90% of them, depending on what survey you read, weren't actually ready to stop. And that leaves them feeling a whole range of emotions, through from anger at what happened. You told me breastfeeding was really good for me and my baby. Why wasn't I able to do it? Through to sadness, through to grief. And I've written about this a lot in a lot of blog articles, just about how it can really damage women emotionally and damage them for a long time when their feeding plans don't go to plan. And it's not just necessarily a bit of sadness and a bit of, all right, I'm happy to formula feed. It's the whole of the context of what it means. And again, what my research has done over I think 13, we might be up to 14 or 15 by now, is actually trying to figure out what's gone wrong. So why do we have women who really want to breastfeed their babies not being able to do so? And there are multiple layers on them there. There's issues with not enough investment in support services for them. There's issues with partner attitudes, there's issues with pressures from work, there's issues about how we see women's bodies and not liking them breastfeed in public. There's issues with not being able to get a medical diagnosis if something is going wrong. And it is all brought down with women ending up feeling really guilty. So that's the context of what I do. And I've been reflecting alongside a number of other people in the last few weeks about what does this all mean in the COVID crisis? Where are we with breastfeeding support at the moment for women? And how are we making sure that families actually get the information and support that they need? What I was going to show you was a screen that showed a Cochrane review about the importance of breastfeeding support for women. And it talked about how when women get really good support, their breastfeeding experience is more likely to go smoothly. That's not saying that absolutely every woman who tries to breastfeed and gets amazing support will automatically be able to do it. There will always be instances where it just doesn't work sometimes for women. But looking at women as a kind of a larger group, for most, if they get good support, it will be a generally more straightforward experience. And what struck me when looking at that Cochrane review earlier was one of the things that they highlighted was that face-to-face support was the very best way of supporting women. And they found that when women had regular support from people they knew and trusted over time, antenatally, postnatally, and it was face-to-face, then that really helped them. And of course, that's gone out of the window with COVID, hasn't it? We just aren't able to give the same level of support we did before. So what that means for women is they may not be able to have somebody coming around and checking their latch so much. It might not be that there to have those very small adjustments that might really help them. They haven't got necessarily someone in the same room as them. And yes, you can have somebody on a video call, but it's not necessarily the same in terms of body language and emotional support that you can feel from being near someone. It also means that they don't get the face-to-face peer support. And with peer support, it's not just about going along to a group of other women who know how you're feeling and can help you to breastfeed. It's about that solidarity of being able to go along and maybe just sit in the corner drinking a cup of tea and not saying anything and realizing that everybody just gets it. So when we realized all this was happening, I was just amazed. Amazed is possibly the right word, because it sounds like I didn't think it would happen, but just in awe, maybe, of how much the breastfeeding organisations, lactations consultants, health sisters, midwives, they all just managed to produce this complete change in how they delivered their services. So video support, online support, online peer support groups where women can come along and meet other women. It's been fantastic. There is just this whole community out there now. And just started thinking there again, but what does that mean? So for your average woman, if you're now sat at home trying to breastfeed your baby in the time of COVID, are you going to have a better experience? Are you going to have a worse experience? And really, as with anything, it's going to very much depend on who you are and what layers of support and privilege you really have around you. We're starting some research just with the breastfeeding network, so hopefully get this going in the next week, really looking at women's experiences and getting them to tell us about what's happened to them over the last few weeks. And we've based that on some anecdotal evidence that women have been giving me and others when we've been talking about it online over the last few weeks. And it kind of falls into two main things. So you've got the positive elements of how women might actually be protected a little bit during social distancing, in that some women are saying that they're actually having a really positive breastfeeding experience because their situation of having to stay at home and not having lots of visitors around and not feeling they have to rush about everywhere means they've actually got the excuse almost to sit on the sofa and just breastfeed their baby. They haven't got to worry about being seen and being out and about, and kind of that pressure we have on some women, and they feel more strongly that they have to get their life back and they have to be out there, and there's something to be had in being out of the house in the first week, showing that you're busy and coping with life. That's all gone away because you can't really go anywhere unless you're going for a walk. It also means that perhaps visitors who are less welcome won't actually be able to come around and announce. They can't just turn up on your doorstep and insist they're coming in, because you can just point them to the social distancing guidelines. For some women, and again, this is going to be contextual and it's not going to work for all, they might have their partner at home more who can help out, who can really kind of be involved with things. And, you know, if you're an introvert and you've just had a baby, then maybe you're in your little cocoon and you're quite happy that way. As I say, we've also had this huge step up in the support that mums have. So for those mums who prefer having perhaps video support, they didn't really like leaving the house to have to go to a peer support group, just being able to click on a Zoom link and have a peer support group there could be really helpful for them. And again, if you think about women who might not want to go out and see a lactation consultant, then they can have someone Zoom into their living room and just help them and talk to them there. And I think it was Emma Pickett from the Association of Breastfeeding Mothers who was saying that actually technology had worked quite well for her, because she was able to use kind of several screens and really zoom in a way that you probably couldn't with your face, but you could hold a screen up really close when a mum was feeding or something. So we've got that one side, which is kind of really positive, but then we've got the other side, which really might not be so positive. So the first thing that springs to mind is that you can sit here and it's sunny outside and got a nice garden and plenty of space, but a lot of women aren't living that reality if they're cramped in a high-rise flat with very little space and they're really not getting to see the outside world much. You can really see how that's going to really knock on their well-being. If they're trapped with a partner who is either just unhelpful, who is not supportive of breastfeeding and is nagging them the whole time, or women in abusive situations, then I can see how that would really have a really awful impact. And it's something we really need to think about going forward. And we've been raising kind of awareness of this all the way through, of what happens to families in these situations when they're just stuck. They're kind of almost out the way as well, out of sight, stuck in a little room somewhere, not being able to get that support they need. So again, it kind of worries me that we might see a situation where mums who are really privileged already and really have the support system around them have a much better breastfeeding experience, and those who were struggling are going to have a much worse breastfeeding experience. And the kind of split there, and how we really make sure, if this carries on for longer, if we have a second wave, if we have any similar event in the future, then how do we actually make sure that mums are all right in those situations? Online support is great as well, as long as you've got a screen big enough to do it, as long as you've got a stable internet connection. If you haven't got a good internet connection and you can't get into the Zoom chat to talk to the other mums, where does that leave you? It also worries me about women. We've seen generally, haven't we, with COVID, that people aren't going to A&E so much. They aren't reporting concerns to their doctors. They're worried either about catching it or putting pressure on the system that is already struggling. And it does worry me that if a mum had difficulties at home, she might go, maybe I shouldn't bother anybody with this. Maybe I should, just try and carry on, and she could end up with quite severe mastitis or something before she actually sought help. So it's that kind of side of things. Other people, if you're an extrovert, if you're an extrovert, or if you have really supportive people, then you're going to want to be out and about. If you thrive from people being around you, then you're probably going to feel pretty awful inside. If you've got really supportive family members who would have usually come to you, then of course that's going to be a knock-on impact. Or if you're trying to look after other children as well. I mean, I can't imagine how awful it must be to be stuck somewhere tiny with other children, young children to look after as well. And I just want to think from a researcher perspective going forward, how we can also work together to make sure that women aren't experiencing that. Just the slide I was going to finish with, and we can put it up for you. Just two main sources of information. I was going to say, if any breastfeeding mothers are out there or anybody supporting them, please, all the main breastfeeding charity lines, they're still running. We'll put the details in the link for you. They're there, they're answering your calls, they've got online resources. The second one is the Association of Breastfeeding Mothers. If you go to their website and you click on the link that says COVID, they've actually compiled a whole list of different resources that are online, that they're trusted, they've been vetted, all for all sorts of different questions, through from latch to normal baby behaviour. So you've really got a package there as well if you need support and help. And I think that would just be my message to you, saying, if you're a breastfeeding mum out there, we know it matters to you. We're trying to support you as much as possible, and please do reach out and ask what support is there in a way that you can access and is best for you.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.